The bed behind me is Sam's home. I'd like to start by telling you her story. Sam is 43 years old and she's been homeless in Surrey for around 5 years. Sam has been in prison, she is an ex-heroin addict and she's currently on antipsychotic medication. After leaving prison, Sam rented a flat, but while she was in hospital for serious self-harm, her flat was repossessed along with all of her belongings. Sam told me that she can communicate with her children through letters, but she has not seen them for some years. Sam's story is very important because she was a looked after child or a child in care in Surrey. And that's where I come in. My name is Annabel Watson and my PhD aims to inform policy for Surrey County Council to help improve outcomes for people like Sam. This project is necessary because Sam's story, sadly, is not unique. Looked after children tend to do worse in education, they're more likely to experience homelessness, to be criminalised, to become pregnant or parent at a young age, to be addicted to drugs or alcohol, suffer from mental ill health, and have children who themselves become looked after children. My project aims to address these outcomes. My project involves a questionnaire sent to currently looked after children and young people who used to be looked after. The questionnaire asks about the experience of being looked after and the outcomes of those who have left care and the opinions of all on what can be done to improve care in Surrey. Similar research has found that factors such as a high number of social workers or placement changes tend to be associated with some of these negative outcomes. I expect to find similar patterns in my own data. I'm also using a small number of interviews with professionals to ask what they feel needs to change based on their professional experience. The data I collect will be used to create static computer models to help formulate policy. I'm likely to get similar results to existing research. However, where my research differs is that it is Surrey specific and that I have designed data collection which specifically asks the service user, in this case the young person or the professional, what they feel needs to change to improve some of the issues they identify, where other research tends to use an adult external to the service to make these suggestions. The policies I create will be presented to Surrey County Council and implemented to change the way that young people travel through care in Surrey and to improve outcomes by introducing protective policies to prevent young people from achieving the factors which I find are identified with these negative outcomes. My aim for this project is for the voices of children and young people to be heard and for policy to be implemented to improve outcomes for the next generation of looked after child. I'd like to leave you with one thought. What could Sam have been for her community, for her children and for herself if only care had cared a little bit more? Thank you.